If you are going days without a bowel movement, your stomach feels heavy, you feel bloated, you strain in the bathroom, but nothing happens. For millions of people around the world, this is daily life with constipation. Many people buy stool softeners thinking they will solve the problem, but recent medical evidence shows something surprising. Most stool softeners don't actually work for chronic constipation. So if stool softeners fail, what actually works? In this video, we will explain what constipation really is, why it happens, why stool softeners often fail, best medical treatments, natural remedies and home treatments, dangerous warning signs you should never ignore. Stay till the end, because one simple daily habit can dramatically improve your digestion. What is constipation? Constipation is a digestive condition where bowel movements become infrequent, difficult, or incomplete. Doctors usually define chronic constipation as less than 3 bowel movements per week, hard or dry stools, straining during defecation, feeling that the bowel is not fully empty. Chronic constipation affects about 10% of the population worldwide. But constipation is not just uncomfortable. It can lead to hemorrhoids, anal fissures, abdominal pain, bloating, poor quality of life. Some research even shows that people with chronic constipation report quality of life impairments similar to chronic diseases like diabetes or COPD. How normal bowel movement works. To understand constipation, we must understand how digestion normally works. Food travels through the digestive tract in several steps. 1. Mouth. Chewing begins digestion. 2. Stomach. Food mixes with acid. 3. Small intestine. Nutrients absorbed. 4. Large intestine. Water absorbed. 5. Rectum. Stool stored until bowel movement. The colon moves stool forward using rhythmic muscle contractions called peristalsis. When stool reaches the rectum, nerves send signals to the brain. The urge to defecate occurs. If this system slows down or becomes disrupted, constipation develops. Types of constipation. Constipation is not one disease. Doctors divide it into 3 main types. 1. Normal transit constipation. The colon moves normally, but stool becomes hard, often caused by low-fiber diet, dehydration, sedentary lifestyle. 2. Slow transit constipation. The colon muscles move too slowly. Stool stays in the colon too long. Too much water is absorbed. Stool becomes hard. 3. Outlet obstruction constipation. Here the colon works normally, but the pelvic floor muscles don't relax properly. This causes difficulty pushing stool out. Feeling of incomplete evacuation. Major causes of constipation. Constipation has many causes. Let's explore the most common ones. Poor diet, fiber. One of the biggest causes of constipation worldwide is low fiber intake. Fiber is found in vegetables, fruits, whole grains, legumes. Fiber absorbs water and increases stool bulk. Without fiber, stool becomes small, dry, hard. Fiber is considered one of the best long-term treatments for constipation. Dehydration. Water is essential for soft stool. If the body is dehydrated, the colon absorbs more water from stool. Result is hard stool. Doctors usually recommend at least 8 glasses of water daily for constipation management. Lack of physical activity. Movement stimulates bowel movement. Sedentary lifestyle slows intestinal motility. This is why constipation is common in elderly, bedridden patients, office workers. Even simple walking can improve bowel movement. Medications. Many common medications cause constipation. Examples include opioids, antidepressants, anticholinergic drugs, iron supplements, calcium channel blockers, antacids. These drugs reduce intestinal motility or increase water absorption in the colon. Hormonal and metabolic diseases. Several diseases can cause constipation. Hypothyroidism, diabetes, hypercalcemia, pregnancy. These conditions affect intestinal nerve function or metabolism. Neurological diseases. The colon depends on nerve signals. Neurological disorders that cause constipation include Parkinson's disease, multiple sclerosis, stroke, spinal cord injury. These diseases impair bowel motility. Psychological causes. The brain and gut are closely connected. Stress and emotional problems may contribute to constipation. Examples include anxiety, depression, eating disorders. Ignoring the urge to defecate. Many people ignore the natural urge to go to the bathroom. Common reasons: busy work schedule, public restroom avoidance, travel. Over time, the body becomes less sensitive to rectal signals. This worsens constipation. Aging. Constipation becomes more common with age because metabolism slows, muscle tone decreases, medications increase. The role of gut microbiome in constipation. Another important factor in constipation is the gut microbiome. Your gut contains trillions of bacteria that help digest food and regulate bowel movement. When gut bacteria become imbalanced, constipation may occur. Fiber helps the microbiome by feeding beneficial bacteria. These bacteria produce substances called short-chain fatty acids, which stimulate bowel movement. Some studies show fiber also increases beneficial bacteria such as bifidobacteria, improving digestive health. Why stool softeners often fail. Now let's discuss an important myth. For decades, people believed stool softeners are the best treatment for constipation. But recent research shows something surprising. Doctors now say there is little evidence that stool softeners work for chronic constipation. Studies found that common stool softeners like docusate sodium perform no better than placebo. They also performed worse than fiber supplements like psyllium. Experts reviewing treatment studies found insufficient evidence to even grade stool softeners as effective therapy. So why are they still used? Main reasons: cheap, widely advertised, commonly prescribed after surgery. But modern gastroenterology guidelines recommend other treatments instead. Treatments that actually work. New medical guidelines recommend several treatments with stronger evidence. Effective treatments include polyethylene glycol, bisacodyl, sodium picosulfate, linaclotide, plecanatide, prucalopride. These medications have stronger evidence for chronic constipation relief. Fiber supplements. Fiber supplements increase stool bulk. Common options include psyllium, methylcellulose, bran. Fiber absorbs water and stimulates bowel movement, but fiber works slowly. Patients must use it consistently for weeks. Osmotic laxatives. These medications draw water into the colon. Examples: polyethylene glycol, lactulose, magnesium salts. They soften stool and make bowel movement easier. PEG is considered one of the most effective treatments for chronic constipation. 19. Stimulant laxatives. These medications stimulate colon muscles. Examples: senna, bisacodyl. They are useful for short-term relief but should not be overused. New prescription treatments. Modern medicines target intestinal secretions. Examples include linaclotide, plecanatide, lubiprostone, prucalopride. These medications increase intestinal fluid and improve motility. Home remedies for constipation. Now let's discuss natural treatments that can help. Drink warm water in the morning. Drinking warm water stimulates bowel movement. Many people find relief by drinking water immediately after waking up. Eat fiber-rich foods. Fiber is one of the most important nutrients for digestive health. There are two main types of fiber. 1. Soluble fiber. This fiber dissolves in water and forms a gel. Examples include oats, barley, psyllium, apples, beans. Soluble fiber helps soften stool. 2. Insoluble fiber. This fiber does not dissolve in water. Examples include wheat bran, vegetables, whole grains. Insoluble fiber increases stool bulk and speeds up bowel movement. What research shows about fiber? Scientific studies show fiber can significantly improve constipation symptoms. A large analysis of randomized trials found 66% of patients improved with fiber therapy. Stool frequency increased. Stool consistency improved. The benefits were strongest with psyllium fiber at doses greater than 10 grams per day for at least 4 weeks. However, fiber should be increased slowly. Too much fiber suddenly can cause gas, bloating, abdominal discomfort. Prunes. Prunes are one of the best natural laxatives. They contain fiber, sorbitol. Both help soften stool. Natural foods that improve constipation. Many natural foods work as gentle laxatives. Some of the best foods include 1. Prunes. Prunes contain fiber and sorbitol, which naturally soften stool. 2. Kiwi fruit. Eating 2-3 kiwi fruits daily can increase bowel movement and reduce abdominal pain in constipation patients. Eating well. 3. Rye bread. Rye bread contains high fiber that stimulates bowel movement. 4. Chia seeds. Chia seeds absorb water and increase stool bulk. 5. Flax seeds. Flax seeds contain fiber and natural oils that lubricate stool. Doctors often recommend a morning routine to stimulate bowel movement. A simple routine may include: first, drink warm water after waking up. 2. Eat a fiber-rich breakfast. 3. Drink coffee or tea. 4. Sit on the toilet for 5-10 minutes. Coffee stimulates colon contractions in many people. Physical activity. Exercise improves intestinal motility. Good options: walking, yoga, cycling. Even 20-30 minutes daily helps digestion. Proper toilet habits. Best practice: go to the toilet at the same time every day. Do not ignore the urge. Relax during bowel movement. Dangerous signs of constipation. Constipation is usually harmless, but sometimes it can indicate serious disease. Seek medical help if you notice blood in stool, black stool, unexplained weight loss, severe abdominal pain, vomiting. Persistent constipation after age 50. These symptoms may indicate colon cancer, bowel obstruction, inflammatory bowel disease. These symptoms may indicate colon cancer, bowel obstruction, inflammatory bowel disease. Complications of untreated constipation. Chronic constipation may cause hemorrhoids, anal fissures, fecal impaction, rectal prolapse. Prevention tips. Long-term prevention plan. The best treatment for constipation is prevention. A healthy daily routine should include daily habits for healthy bowel movement. Eat 25-35 grams of fiber daily. Drink 2-3 liters of water. Exercise regularly. Avoid excessive processed food. Maintain regular bathroom habits. When these habits are followed consistently, constipation can often be completely prevented. But the good news is, it is usually preventable and treatable. Remember, stool softeners often do not work well for chronic constipation. Fiber, lifestyle changes, and proper medications work better. If you found this video helpful, like the video, comment your experience with constipation, share this video with friends and family, and subscribe to this channel for evidence-based health information explained in simple language. Because good health begins with knowledge.